Influenza Week is observed in December, and joining me now is Dr. Gallagher with the Division of Infectious Diseases at Baystate Health. Thank you so much for joining us.
You're very welcome.
So can you first tell us about the flu this year? What can people expect?
So last year, we really did not see much in the way of influenza at all, but we do expect that there's going to be more influenza activity this year.
Okay, and obviously one thing to help combat against the flu is to get the flu vaccine. Why is it important for people to get the vaccine?
Yes, absolutely. Very important to get the flu vaccine because it reduces your chance of getting the flu. And even if you do get the flu, it reduces your risk of getting severely sick from influenza so that you don't end up hospitalized or in the ICU. So it helps protect you as well as helps prevent serious illness from influenza.
And when is the peak flu season for people at home?
In general, around here, we tend to see peak flu season in January or February, but it does vary year from year and sometimes can occur earlier or later. In general, we see most influenza activity during the winter months when it's cold, people are indoors, the air is dry, and all of that makes it much easier for the virus to spread.
So I can imagine now would be the perfect time to get that flu vaccine if you haven't. And what are symptoms people should look out for if they are worried that they might have the flu?
So symptoms of the flu include fever, shaking chills, muscle aches or body aches that are often very severe. Sometimes people can have difficulty breathing or a cough.
Okay, and where can people get some more information about the flu? And also, I'm assuming if you do feel like you have any of these symptoms, it's best to see a doctor.
Absolutely. So if you have any symptoms that you think could be the flu, you should definitely reach out to your doctor or local urgent care clinic. One of the important things to know is that the symptoms of the flu can be very similar to symptoms of COVID-19, and it's important to get evaluated and get tested because we do have effective antiviral treatments for the flu, and they're more effective the earlier they're started. So if you can get diagnosed right away and get on treatment, it can hopefully prevent you from getting more sick.
Okay, great advice. Thank you so much for joining us today and providing us all that great information. That's all the time we have, but have a great day.